That was a very informative presentation indeed. I would now like to invite our next presenter, Dua Nadeem Akhtar from Muhammad Medical and Dental College, Ibn-e-Sina University, and she is going to present her research on anger management among medical undergraduate students and its impact on mental health and academic performance.
Assalamu alaikum. I am Dua Nadeem Akhtar from 3rd year MBBS, Muhammad Medical College, Merbrook Khas. Today I am going to present anger management among medical undergraduates and its impact on their mental health and academic activities. Behind every white coat there is a human being who sometimes feels stress, pressure and yet anger too. Today we are going to explore how it impacts their life and also how it shapes them. Anger is a common behavior seen among the medical students with potent negative consequences on their mental health for their interactions and academic performance. Understanding its triggers and effects can guide preventive interventions. The aims and objectives of our study was to assess the prevalence, triggers, and mode for coping their anger among medical students. The cross-sectional study was conducted at Muhammad Medical College and Dental College also included in the month of July 2025. A total of 200 undergraduate students, 174 from MBBS and 26 were from BDS. Participated, data was collected through online Google Performa. The Novaco anger scale was also included. Now the discussions. Friends and family were the major anger triggers. Academic pressure was secondly the 58.7% and the workload was 30.4%. Most episodes were short, less than 1 minute, and some lasted whole day. Consequences were anorexia, hopelessness, sleep issues, and self-isolation. The coping strategies were surprising, like internalization, peer support, physical activity, and low help seeking. Highlights for counseling, stress management, and workload relief were needed. Now to the results. Surprisingly, the triggers of anger, friends were the major reason and the most common too. And the second was 46.4% that was due to their family. Consequences of anger. Hopelessness was observed at 28.2% and the self-isolation was 36.6%, which is for our keys. And self-isolation was 36.6%. The duration of anger, some expressed their anger was less than 1 minute, but the one that was our huge concern was that 21% showed their anger was full day. The coping mechanisms were the physical activities like exercise, talking with friends, walking, talking, and also internalization. The contributing factors were workload and academic pressure, 65.9%. Conclusion, among the medical students, it is primarily triggered by interpersonal conflicts and academic stressors leading to their significant effects. While most of the students expressed short episodes, considerable amount of 21% showed their anger was full day, with very low professional help seeking despite recognizing the value of their counseling. Addressing anger in medical students can prevent progression to anxiety, depression, and burnout. The limitations were the single-center study with a limited size sample, reliance to self-supported questionnaires, acknowledgement, special thanks to the participants and the faculty of Muhammad Medical and Dental College. Our reference was from Novaco anger scale and Liaquat scale. Thank you. No.
Thank you, Dua. Do you have any questions?
Just one question. पहले तो इतनी खुशी होती है इतने यंगस्टर्स को देख के पोडियम के ऊपर कि वो अपनी रिसर्च प्रेजेंट करें. हमारे दिनों में तो ऐसा कुछ नहीं होता था. So we really feel proud and satisfied कि हमारी यंग जनरेशन इज़ बेटर देन अस. सो दुआ बेटा बस एक क्वेश्चन है मेरा कि जो आपने क्वेश्चनर यूज़ किया है उसमें उसकी वैलिडेशन का हमें कहीं कोई एविडेंस नहीं मिला कि ये आपने क्वेश्चनर किसी प्रीवियस रिसर्च से किया था या अगर नया क्वेश्चनर था उसकी वैलिडेशन कैसे कराई आपने?
Sir, the questionnaire was basically in form of a Google form that was online and the students were able to access this through the online Google Forms on their Gmails.
Well, that was the type of methodology और कह लें आपके आपने एक tool use किया एक electronic form का, but still the question is unanswered कि उस questionnaire की validation कैसे की आपने?
Sir, the evaluation was basically on a Noeco anger scale and a Likert scale from which we evaluate our results.
Thank you, beta. Thank you so much.
Thank you, sir.
Thank you, Dua, for such a wonderful presentation.